Hi guys, I looked into the therapy called AphasiaScripts used to treat aphasia. I found this type of therapy very interesting because I've never thought of the possibility of speech and language therapy to be conducted via a computer software system with a virtual therapist. The treatment that was utilized in this study is the computer software program called AphasiaScripts, created by the Rehabilitation Institute of Chicago in 2007. The virtual therapist in this program produces natural speech along with correct movements of the speech articulators. This treatment provides a more realistic conversational context for practicing language skills rather than working on single word tasks. The scripts can be in the form of a conversation with turn taking or even in the form of monologues, such as telling a story. Those who can benefit from this type of therapy are those with chronic aphasia, such as Broca's, Wernicke's, and anomic aphasias, just like the participants in the study. The article investigated the hypothesis that computer script training programs, specifically AphasiaScripts, help improve linguistic skills required in social situations that occur in everyday life. The study sample of their research included 3 participants who suffer from chronic aphasia. They were assessed before and 9 weeks after therapy with this computer script training program. Each participant had aphasia subsequent to a left hemisphere stroke and were all literate in English prior to their stroke. Each participant had 3 individualized scripts that were recorded on the software for them to practice at home, and then they met with an SLP on a weekly basis to assess their progress. The outcomes measured in the individual scripts included content, grammatical productivity, and rate of production of script-related words. The outcomes measured pre- and post-treatment included comprehension, repetition, naming, communication activities of daily living, and others. Improvements and positive changes were seen for all measures of all 3 scripts for each participant. The participants and/or their family members reported increased verbal communication, improvements in other modalities, and increased confidence after completion of the therapy. It was concluded that this type of therapy has positive effects for those with non-fluent aphasia as well as fluent aphasia. Some of the strengths of the study included thorough preliminary research to determine if this type of therapy is beneficial in patients with a variety of different types of aphasias. Some of the limitations of the study included an extremely limited number of participants and the age of the participants. They were all at least 65 years old with limited knowledge on how to use a computer. This treatment works because it focuses on dialogues rather than the correct production of individual words, and it is also a progressive therapy that is laid out to the patient, so they know that there will be less help from the virtual therapist as they continue to improve. And one of the questions that I still have regarding this treatment is that if this is a mix of both virtual therapists and actual sessions with an SLP, what type of therapy would the SLP work on during the actual face-to-face sessions? Thanks, guys.